But small bone, but really important. And, oh, and that's the other thing I wanted to mention. I totally forgot about it. Here, I'll use the skeletons right next to me. This is really something I didn't want to mention. I should leave myself notes. The clavicle, there's only two places on our skeleton where the axial skeleton and the appendicular skeleton actually articulate. In other words, come together. I mean, you're thinking, oh yeah, well, you know, your arms, your legs, that's not it. One of them is a very small articulation and is easily overlooked. But remember, the thoracic cage, the rib cage, the sternum, the manubrium in the sternum is part of the axial skeleton. So right here, at the sternal end of the clavicle, this is actually a small joint. It's a joint which has a very small amount of movement associated with it. But this is one of the 2 points, and we'll get to the second one when we get down a little lower. This is one of the 2 points where the axial skeleton and the appendicular skeleton do articulate, right here at the sternal end of the clavicle on the manubrium of the sternum. That's one. The other one you know about, but you just don't realize you do quite yet. So the clavicle is a very important bone. We haven't talked about articulations yet, about movements at joints, but the movement at the pectoral girdle, just not the arm, but right here, is what they're calling elevation and depression, which is basically just, you know, this in protraction and retraction. Right? So those are really, and we'll get to those movements next week, but that's one of the relatively few movements allowed at this girdle. The next bone, this is a, excuse me, this is a plastic one. Obviously, you know, this is the shoulder blade, scapula. And you know what? This is a good comparison to make. Once again, you can, oh, they're all plastic. Oh, darn. Well, somewhere in our collection, I'm sure it'll show up tonight, we've got a real scapula. And it must have come from a very small woman because, and it's old, of course. I don't know how long we've had it, but it's so thin you can almost see through it. So this is the shoulder blade, scapula. And the scapula is well, gosh, it's a very important muscle in terms of movement of the arm, because there's, when we study the muscles in our next unit, starting on the 11th of July, there's lots and lots and lots of muscles which, you know, are attached, I can't think of the word I wanted, to the scapula. The muscles of a big group called the rotator cuff are all related to the scapula. So there's several features on the scapula that when you learn them now, and then, so for example, there's a little depression here, which is called the supraspinous fossa. I mean, that's on the list to learn. The supraspinous fossa. Fossa, remember, is a shallow depression. So it's this depression right here. This is the spine of the scapula. And you can feel this, of course, right through your back. But this is the supraspinous fossa. You'll learn in a couple of weeks that the muscle, which is located on this fossa or originates on this fossa, it's the supraspinous fossa of the muscle, is the supraspinatus muscle. There's another depression or fossa on the inferior side of the spine. It's called, it's on here, yeah, right here, the infraspinous fossa. The muscle which originates there is the infraspinatus muscle. So you kind of learn the bones first, and then it's go, oh yeah, okay, I got it now. It was on it's on the scapula. There's a little shallow depression here called the glenoid cavity, which I just happen to have, yes, a humerus right here. I don't know if they're rights or lefts, but anyway, the head of the humerus fits in this rather shallow depression. You'll learn next week this is, and I'm sure this isn't a surprise, you know this already, a ball and a socket joint. There's only 2 of them in the body, here and down here. I guess there's 4, 2 and 2. But anyway, so the head of the humerus articulates in here into the glenoid cavity. So we'll get to the humerus in just a second. A couple of other obvious big projections here. The acromion and the coracoid process. These, oops, almost dropped it, but it's plastic. This little one here, this more pointy one, is the coracoid process. And some of these words I actually know the origin of. A lot of them I don't. But this one, if you look it up, it's got a Latin origin, and this may not make any sense at all. But coracoid is comes from, like, I don't know what part of the Latin, but it means beak, right? And it does kind of look like a little beak. Acromion The flatter one is the acromion here, and that's where the acromial end of the clavicle articulation. You sort of feel these through your, the bumps and things like here in your shoulder. You can sort of feel these things. And the other night, I forgot to mention this, the cribiform plate. It's like, what in the world, what does cribiform mean? It didn't seem to make any sense. I mean, but you look it up in the dictionary, and cribiform is Latin for perforation. I didn't know the Latin language had perforation in it, but remember it does have little holes in it, so now it kind of makes sense. So anyway, there's no perforations on this. So we've got little beaks here, we've got shallow depressions, we've got fossas, another big fossa here, which is the subscapularis down here. Subscapular muscle attaches there. It's got borders, medial, lateral, and superior borders. So a small little bone, actually a fairly big bone, with lots and lots and lots of little features on it, which are primarily, almost all, related to muscles which attach to this that allow us to move our arms and everything around. Now, it's possible, of course, to fracture your scapula. It takes a pretty good blow to do that. A separated shoulder, an athletic injury, a separated shoulder actually involves kind of the pulling of the scapula away from some of the underlying tissue. That's a possibility, of course. But a dislocated shoulder is not a broken scapula. It's just the head of the humerus pops out, and generally speaking, it just pops back in. I mean, under medical supervision, it pops back in. Under some people, sitting right off here to my right, freaking dislocated shoulder. Well, don't show us because it'll freak me out. We'll do that on Tuesday night. You were here last night, Patrick. We were talking about just double jointed, yeah. And well, if he wants to show you later, I'll leave the room. I make it sound like he belongs in the sideshow. But I mean, some of the things. I somehow or other in micro, I don't know how the hell this came up, but something about double jointed